All right, my friend, welcome back. This is Dr. Anthony Balduzzi from the Fit Father Project, and this is a highly requested video here on our channel. It's breaking down testosterone therapy for men. We're going to talk about what it is, if it may be right for you, what are some of the benefits and different forms it comes in, what are some of the real research-backed health risks, and at the end of this video, we're going to give you some alternatives and our overall stance on TRT. I know you're going to learn a ton in this video, so get out your pen and paper, take some notes, and let's dive on in.
FitFatherProject.com.
So over the past few years, testosterone replacement therapy has gained a lot of popularity, partly because of media and marketing, but partly because it can produce real results and life-changing results for guys who do have testosterone deficiency. So let's look at the big picture first. And that is that after age around 35, men's testosterone levels naturally decrease by about 1% every year. And that means that when you're in your 60s, you might have 25 to 35% less testosterone. And for some guys, this leads to a lot of problems. It leads to feelings of low energy, no sexual drive, even depression, inability to build muscle and lose fat. So these are things that are real symptoms of testosterone deficiency in men. But our bodies naturally decrease in testosterone. But what also happens is when we put on the whole layer of our modern stressors, meaning we're living in stressful environments, we're not sleeping enough, and there's also a lot of estrogens in our environment from plastics, from things that are in our water supply, men's testosterone levels are being bombarded. So there's a lot of guys that are turning to TRT as an option to feel better, and when some guys do take it, they feel substantially better. So what is testosterone replacement therapy? Well, quite frankly, it is administering external, which I'll use the word exogenous from here on out, testosterone in a variety of different forms that we're going to discuss to replace the body's lacked production. So under normal circumstances, our brain communicates with our testicles to produce testosterone levels. And normal men's testosterone levels are anywhere from 280, which is on the baseline of the low range, nanograms per deciliter, up to around 1,000. So when we're teenagers, we're on the higher end of the range, and we slowly decrease over time. And there are a lot of reasons why your testosterone could be in the low range. So what testosterone replacement therapy is for guys on the lower end of the range, which is a very debatable topic as we're going to talk about where that lower end really falls in. It's taking external testosterone through either injection, through pill, through cream, through an implantable pellet that actually gives your body testosterone. What happens is that testosterone binds to the androgen receptors on your cells and does all the things that normal testosterone would do. And as a result, your body stops producing its own testosterone for the most part. When we take it externally, it provides a feedback loop in the body, and the body stops taking testosterone. And I need to also say this point here, is that there's not too much of a difference between an anabolic steroid that a bodybuilder may use if they're using pure testosterone and the stuff you would get in testosterone therapy. In fact, a lot of bodybuilders use the exact same thing that you might get in injectable testosterone cypionate. The bodybuilders use the same drug. It's the dose that changes the difference. So a normal testosterone replacement therapy dose may be anywhere from 75 milligrams up to 150 milligrams on the very high end per week. If we're talking in an injectable form, a bodybuilder will take 5 to 10 times that amount. So you need to know just to kind of clear that thing up. And there are other bodybuilding drugs that people use. When we're talking about testosterone replacement therapy, we're talking about taking testosterone, the actual molecule that our body produces. It's just bound to different kinds of salts depending on the delivery mechanism. So is it right for me? Well, this is really a question for your doctor in getting some real lab work. We need to combine lab work. Where do you fall on the total testosterone picture? So we want to know where you're at on your total testosterone range, which you can do with a simple blood test. We'd also want to know what your free testosterone is, because a lot of guys don't realize your total testosterone levels don't give the whole picture. There's something called sex hormone binding globulin, SHBG, that binds up your testosterone and keeps it from actually acting on these nuclear testosterone receptors. But we have a free level, which is basically how much is bioactive, and that can be low in guys. So you could have high total testosterone and low free, and it still could be indicated for you. But again, your doctor needs to really work with you on what's your blood work and what are your symptoms, and does it fit the picture? And it's kind of like the wild, wild west right now on testosterone levels that people are prescribing on. Some doctors are prescribing testosterone replacement therapy for guys in ranges around 500. Others think that's absolutely crazy, and you need to wait until you're around the 200, 300 range. So it's very dependent on your relationship with your doctor, what they think is medically safe for you based on your history. So this is something that the take-home point here, go to your doctor if you're interested in going down this route and get supervision for your particular circumstance. We can't just say, oh, you have testosterone levels of 400. it's good for you to do TRT therapy, because there's other alternatives that we're going to talk about on ways you can potentially increase your testosterone naturally that does not require going on TRT, which again shuts down your internal production. Is it a long-term thing? If you want to do TRT, it's something that you're sticking for. It's not like you do it for a little bit and you necessarily come off. Let's talk about the benefits. Well, when you have more testosterone and you've been deficient, you're going to find that the number one thing guys start to experience is an overall greater sense of well-being and energy. A lot of guys who feel like they're just lethargic and exhausted all the time and feeling kind of depressed, when they start TRT, they feel better, they feel youthful, they feel the vigor, because testosterone acts on our brains too. And what we know is that testosterone deficiency, being low in testosterone, is a risk factor for Alzheimer's and cognitive decline. So you don't want low testosterone levels, you don't necessarily want super high levels either. We can talk about that in a little bit. So guys start to feel better. You might find that your muscle mass increases a little bit. You might find that it's easier to recover from your workouts and you lose fat a little bit better. But do know this, just taking testosterone replacement therapy without changing your diet and your exercise is not going to turn you into Arnold Schwarzenegger. You need to have the whole plan in place, but it can augment your results on those things. The forms that testosterone replacement therapy comes in. The most common form, I would say, would either be a gel, so you can rub gel on your skin. It can deliver the testosterone transdermally. Other guys use injections, which I would say is honestly a better option because you can be a little more standardized with your dose. And you know, I'm injecting X amount of testosterone per week, so we can track that with blood levels. Versus a gel, there might be some differences and how much is absorbed for any given day. Did you have something on your skin where you're sweaty? A little more variability. But there's other methods too for guys who don't want to have to get injected once a week, once a month, depending on your doctor's schedule and the testosterone they may choose for you. Might do something like a pellet where they can actually implant a little pellet into your hip. That dose time releases testosterone, and now there are even some oral forms that are available. But with a lot of these oral forms of testosterone and derivatives of testosterone, you have to worry about the effect on your liver, because your liver typically has a first pass metabolism, where to survive that first pass metabolism, they have to add certain methyl groups and stuff to the testosterone that can be a little hard on your liver. So that is a concern as well. The cleanest route seems to be injection for most people who go down TRT, but the pain in the ass, pun intended, is you got to inject yourself often, whether that's going to the doctor's office or you can even do it at home under certain circumstances. But again, you also have to work with the doctor and see what the laws are in your state. So let's talk about the medical risks. Because as good as testosterone sounds like, wouldn't we all want more vigor, more muscle building, more fat loss, better sense of confidence and energy? There are legitimate risks because testosterone does certain things to the body. The first main thing we see with most people who start TRT is they do have a thickening of their blood. And this is largely evidenced on blood work as your hematocrit, which is the percentage of your blood that's filled with red blood cells. Testosterone causes your blood to be thicker. It causes your body to produce more red blood cells. This increases your risk. It's not causative, but it increases your risk for certain heart problems. You have thick blood pumping through those arteries, increases your risk for potential things like strokes and blood clots like that. So some people who are on TRT, they need to have this aspect managed, get regular blood work, and some people even take baby aspirin to thin the blood a little bit to make sure it doesn't get too thick. Another risk that can happen is for some guys, especially with family histories of male pattern baldness, testosterone can convert to a derivative called DHT. And in DHT, areas of the brain that are very sensitive are right here, balding on the scalp in these particular areas right here. Some guys find that they lose their hair when they take testosterone. And that's not something that necessarily comes back unless you do another different kinds of therapy with stem cells or different things to get your hair back. You could lose your hair doing TRT. Some guys are very sensitive to it. That's why you see a lot of bald professional bodybuilders who have abused testosterone for years, no more hair up top. So if that's important to you, consider that. Additionally, testosterone can increase the oil production of your the glittering glands on your skin. So you can find that, oh man, you have acne for the first time in 20, 30 years if you start testosterone therapy. Another thing worth considering is testosterone doesn't just stay testosterone. Again, it converts to things like DHT and estrogen. Yes, testosterone can turn into estrogen. So some guys find that when they take testosterone, it can convert to estrogen through this process called aromatization. And there are tissues in the male body that are sensitive to estrogen, even our nipples. So some guys find that they have growth of breast tissue under the nipples. So these are real concerns and things that can happen. And doctors do prescribe different adjunct medications often with TRT to block some of these estrogen effects. So you may find things like Clomid or Arimidex, which are things that might block the estrogen receptor or block the conversion of testosterone to estrogen, can be something that's prescribed as well. So the picture here is that TRT is a big decision. If you're going to go down this route, you're going to be managing a lot of different variables than trying to do it naturally. And it may be indicated for you. It's just going to make things a lot more complicated between injections, looking at the kind of schedules of these things, and maybe even taking different kinds of medications to make sure that the testosterone ends up on the right track and not causing different kinds of side effects. So those are the main medical risks, I would say, as long as the fact also understanding that it does decrease your own natural testosterone production. If you do it long enough, you can get kickstarted again, but your levels can really decrease. So if you come off the testosterone, you are going to have lower levels than when you even started in the first place. So it's more of a long-term thing. Some alternatives. Well, depending on what your blood work looks like, there are certain things you can do in terms of vitamins, herbs, and minerals that may be able to increase your free testosterone levels. So stinging nettle is an herb that has some research showing that it increases free testosterone levels. So let's say your testosterone levels are in the middle to normal range, but your free testosterone is a little low. I would say as a first line thing, before we go down the rabbit hole of TRT, is like, what can we do to naturally increase free testosterone levels? Can we sleep more? Because cortisol and testosterone have a seesaw relationship. When cortisol goes up, testosterone goes down. So can we sleep and reduce stress? Can we use things like stinging nettle? Can we take some of these natural precursors that tend to support testosterone levels, like vitamin D, DHEA, magnesium? A good probiotic is also a really good idea as well, and some creatine monohydrate. These things are research proven to help support natural testosterone levels. So if you have not exhausted all those options yet, I would look there first, 100%. And we're going to link an article below in the description called The Natural Testosterone Boosters That Actually Work. And this is where we review all the research and show you which ones work, because there's a lot of crap out there with different kinds of herbs that people claim work, but they don't actually show up in the studies to improve testosterone levels. But there are all alternatives, and there even are some prescription medications like clomiphene, like Clomid, that can increase your free testosterone levels, although it's not testosterone at all. It's an adjunct medication that decreases estrogen, which may improve your testosterone overall load in your body and can give you some of the benefits without necessarily having to go down the TRT route. So we've arrived. What is our overall take on this? TRT can absolutely be life-changing for you if it's medically indicated. And I think a lot of guys are going doctors are going willy-nilly these days with prescribing a lot of testosterone. And in the United States, the FDA is cracking down a lot harder, and they're making sure this is really medically necessary, because there's a lot of people that were abusing these therapies over the past few years. So work with your doctor, see if it's right for you. At the very least, I know you start with some of these alternative therapies to make sure that you've exhausted your options with doing this naturally. And if it ends up being indicated after that, then it could be life-changing for you. So we're definitely big proponents of TRT for the guys it's indicated for, and we also do believe that you first start off with the natural lifestyle stuff before you need to go on TRT. And if you can prolong that decision as long as possible, you're probably going to get the best bang for your buck and keep your body as natural as long as possible. So hope that helps. I know there's a lot of information. We have more linked in the description on articles so you can read this stuff, print it out. And if you like this stuff, give us a thumbs up. Drop us a comment below on your experience. Give us some new research. We're here to have a great discussion on this, because here at the Fit Father Project, it is our mission to help busy fathers and guys over 40 lose weight, build muscle, and really stay strong and healthy for their families. So we have hundreds of videos on our YouTube channel. So give us a thumbs up, drop a comment below, and subscribe to our channel if you want to check out more stuff on the right kinds of diets, workouts, motivation. We have it all here on the channel, and we do deep dive onto important topics like TRT and other stuff for us guys. So hit subscribe, drop a comment below. Thanks for being here, my friend. I hope you found this valuable. If so, let us know below, and I'll talk to you very soon, and I'll see you around the channel.